नमस्कार. परत एकदा तुमकां सगळ्यांक लायव्स ऑन विथ मणिपाल हॉस्पिटल्स या कार्यक्रमात येवकार. आज आमचे कडेन एक वेगळोच दोतोर आसा, लॅप्रोस्कोपिक सर्जन आनी स्पेशलिस्ट इन बॅरिएट्रिक्स. नवेंशें दिसलें न्ही? कितें नवें तें जाणून घेवया. दोतोराचें नांव आसा डॉक्टर जगन्नाथ कुलकर्णी.
Namaste, I am Dr. Jagannath Kulkarni. I am a consultant laparoscopic and bariatric surgeon with Manipal Hospitals, which is located in Donapala, Goa. My department basically deals with the minimal access mode of surgery, which involves the surgeries on the abdomen, gastrointestinal surgeries, the urological surgeries, and the gynecological surgeries, which are amenable for a laparoscopic method of surgery. Even the thoracoscopic procedures can be performed by minimally invasive methods. And another, the special branch of laparoscopic surgery is a bariatric surgery. At Manipal Hospitals in Donapala, we have a very well-equipped setup to conduct the bariatric surgeries. And there are many types of surgeries which have been performed. And I would request everyone to avail these facilities if at all you think that that is the right thing or the surgery for you.
Now, you are a laparoscopic surgeon, and your super specialty for that matter, if I say so, then it is bariatrics.
Yes.
Now, first is, can you tell us what is laparoscopic surgery?
Sure, sir. Laparoscopic surgery, the word laparoscopy means that you are looking into a hollow cavity, or for example our abdomen, through small holes. Laparos actually means abdomen. Scopy means to view or to see. So when we are looking into the abdominal cavity by making small holes using a camera, that is what we call as laparoscopy. So laparoscopy is something that we use on the abdomen. If the same thing is used on our chest, that is called thoracoscopy. So these are the differences in the words which we can use to differentiate between surgeries on different parts of the body. So thoracoscopy is surgeries in the chest cavity, and laparoscopy is basically the surgeries on the abdomen. We can do surgeries on the organs of the abdomen or sometimes the organs which are in the pelvis. So that is what laparoscopy is. So by doing this kind of approach, by using this method, it is possible that we can do the same kind of surgery that was done on patients with an open surgical method.
That is by giving a cut.
By giving a cut. By open surgery, what I mean is by giving a big cut. So for example, basic surgery, something like a gallbladder surgery, wherein people used to have very big cuts before, cut which used to extend from the midline to almost the outside of the abdomen. So that kind of incision, which is around 6 to 8 inches, that kind of incision can be now minimized to 3 or 4 small holes. Holes will be around 5 millimeters in size. So that is a great advantage to the patients, that they can stand on the same day of surgery. After probably I can say 4 or 5 hours after the surgery, they will be able to stand, and pain will be very, very minimal. So they can start their work also early once they are discharged from the hospital. And many a times people do misunderstand that laparoscopic surgery does not clear the entire disease properly. I totally disagree with that. Laparoscopic surgery is probably a better version of doing surgery, because in this surgery we use cameras, or we call them as scopes, laparoscopes. Those scopes, or the high definition cameras, they take us to a place where usually our eyes cannot see the intricate details, and they give us a magnification, around 3 or 4 times magnification, and we can appreciate the tissue better. We can dissect the tissues better, and surgery can be equally effective or probably much more effective. That's what I would say.
You pass the instruments through the scope.
Yes. So
inside.
Yes. So there are some things called as ports. So we use these ports, which are basically either disposable ones or plastic ones, or the metallic ones, which can be reused. So both can be used. They act as ports, where we make a hole, we put that port, so that we put the instrument inside the abdomen and take them out as per need of the patient. So that port acts as a channel through which we insert or take out the instrument. And at the end of the surgery, the same holes or the ports can be used to deliver the specimen. That is how
And
it works.
suturing also you do through the ports.
Suturing also is possible. Once we remove the port, suturing can be done on the skin. So it is basically a very small cut. Cut is, I mean, most of the times it is 5 millimeter. Sometimes it goes up to around 10 millimeters or up to 12 millimeters. That is the maximum cut that patient will have on his or her abdomen. That
What is the
size.
biggest advantage of laparoscopic surgery on
Laparoscopic
any
surgery.
organ?
Right. Now, when a person comes to the hospital, most of the times it is the pain that brings the patient to the hospital. Pain is something that is unbearable. People cannot tolerate pain, any sort of pain, be it anywhere in the body. So when a person comes to the hospital with the history or with the complaint of pain, our responsibility is such that we need to relieve the pain, and if the person requires surgery, surgery is done and the patient goes back home, that should be pain free. So that is the best thing that we can do with laparoscopy, because we put very small cuts on the patient's body or the abdomen, and that small cut is not going to give him the kind of pain an open surgery would give. There are many complications with bigger cuts on the body, such as infections in the wound, and the person or the patient will not be able to get up from the bed after the surgery. And the other added complications such as infections in the wound. Surgery has gone on well, everything is fine, but the wound is infected because of the size of the cut that he has. Or sometimes in people who are a little bit on the healthier side, or they are overweight, or we call them obese, in them the healing of the wound is further delayed because of the amount of fat that is extra or excess in their body that delays healing. So that may further cause complications in the form of infection in an early post-operative period, or sometimes when it is delayed, or a later complication will be in the form of hernias. So
But has the patient choice to decide whether he wants open or laparoscopy?
Absolutely, sir. Patient always has the right to choose what he or she wants. But it is our responsibility, it is definitely a surgeon's responsibility to explain them the advantages and disadvantages of both the surgeries, and then leave the person to decide. We always do that because current generation is basically willing for a short duration admission to the hospital. And that kind of admission and surgical procedure and discharge is possible by laparoscopic method, because the pain is less, bleeding that they experience inside during the surgery is less, post-operatively pain is less, and they walk on the same day, and next day they are good to get discharged. And in fact, when they are done with their early post-operative period, they can go back and start working within a few days, unlike the surgeries which involves bigger cuts on the abdomen.
And say same organ, say let us say appendicitis, appendix operation, with an open surgery and scopic surgery. The time consumed in expert hands like you, means time consumed is less than open.
Okay, appendectomy surgeries, they're usually done by laparoscopy method, and usually they last for, I mean, for me it takes around 20 minutes.
Oh, that's all.
to finish the surgery, for me it takes 20 minutes. And with respect to open surgery, it does depend on the surgeon's experience. If they are, I mean, quite experienced surgeons, they will put an incision, deliver the appendix probably within the same time, probably with a bit bigger incision or a cut mark on the abdomen of the patient. But laparoscopic surgery, absolutely. I mean, in my hands, definitely 20 minutes the surgery is over, and all that patient has is only 2 or 3 small tiny cuts. And immediately after the surgery is over, patients sometimes ask us, where are the cuts? So it's that quick and easy for the surgeon as well, apart from the patient.
So you don't have that big scar which will remind you throughout the life?
No, never. No. Those times are definitely gone, I would say. Those times are definitely gone, and current times, I think, as people are getting educated through various media, be it internet or television or other things. So everybody should be aware of the fact that laparoscopic surgery does wonders when it comes to surgeries on the abdomen or probably on the chest also.
कसले ऑपरेशन करपाचें जालें आसत हाजे फुडें दोनदा विचार करूं जाय. पयलीं सारकें व्हडलें हांगा कातरप आनी मागीर तें शिंवप आनी मागीर ड्रेसिंगां करप आनी अशें बँड जावन चलप हें करतले काय दोतोरा कडेन वचून 2-3 बुराक घालून ते दुर्बिणींतल्यान सगळें करून करतले आनी एका दिसा भितर परत सारकें चलूंक लागून कामाक वतले हें ठरोवपाच्यो वेळ आयल्या. Any specific age where this BMI touches or crosses 40 without all comorbidity,
All
like
right.
what you said.
Okay.
Why I am saying is, see, when a child is young, or say around 7 to 8 years, and the child is chubby,
Right.
then everyone appreciates the child. Ah, he's got nice, he's nice, looks nice, chubby. Falling into the trap of this obesity.
Obesity.
Yeah. So when do you demarcate that the child is going towards obesity? Can BMI in younger children also cross 40s?
Absolutely, it can cross 40s. Children who are pampered a lot, currently we call it as adolescent obesity. That is currently a hot topic actually amongst the bariatric surgeons, because there is an increasing trend of people who are pampering their kids with all possible things like Coke, basically the carbonated drinks, then sweets, then giving them screens in any format, be it mobile phone or an iPad, or you call anything. So screens and all these things, which is basically make them sedentary. When they are sedentary, they are prone to put on weight, a lot of weight. And once a child starts putting on weight, then the child will start putting on more and more weight, because once there is some weight gain, then he will feel that, oh no, let me not do it today, I will do it tomorrow. He will postpone the exercise, basically going outdoors, and there will be a stage wherein he will feel that exercising is a painful thing, so he will absolutely not exercise. And like this, the cycle will continue, and he will reach an age wherein he is already obese and he can't do anything about it. And all through these years, he would have acquired so many other issues such as joint pains or snoring issues, and probably diabetes also. So as much as possible in children, if they are able to play outdoors, avoiding the screens, eating less less of the sugary sweets and other things, so it is a good thing for them. With respect to BMI, there is no such cutoff as such, but if they are obese already, then it is better to train them towards exercises and better diet control.
So prevention is better.
Prevention is absolutely better than
and
cure.
Now can you just tell in short, what is this bariatric surgery exactly?
All right, fine, sir. Bariatric surgery basically involves surgery on the gastrointestinal tract. So what is done here is by laparoscopy method again, because we can't even imagine doing an open kind of surgery on these patients, because they have so much of fat. So it's a laparoscopic surgery which is done in these patients, and it is done on the gastrointestinal tract. It involves the stomach and the proximal part of the intestine, the early intestines what we have. So there are surgeries which decrease the volume of the stomach. So let's presume that the volume of the stomach is around 3 liters. So the surgery that is intended to be performed in them is basically to reduce the size of the stomach from, probably we'll bring it from 3 liters to around 300 ml.
Oh.
So that is a type of surgery wherein it is going to be a restrictive kind of surgery. We restrict the amount of food that one consumes. So when the food entry is restricted, so calories are also restricted. Apart from doing this reduction surgery, there are surgeries which cause bypass of these nutrients when they enter our intestines. So those surgeries are called bypass surgeries. Something that is done in the heart, that you bypass because that part is diseased. Now in them also this part is diseased because it is absorbing everything, and everything is transported to the fatty areas. So we bypass a particular tract wherein the intestines are going to absorb everything. We make that segment ineffective by performing some surgery called as gastric bypass. And there are some surgeries which restrict the food, and that surgery is called as sleeve gastrectomy. We resect a particular part of the stomach so that it reduces the quantity of the food that is consumed. Second surgery which I mentioned was the gastric bypass, wherein we bypass a short segment of the intestine. Intestine is meant for absorption of food. So we bypass that short segment of intestine, and we connect the intestine to a distal most part so that absorption is limited.
Oh.
So here there is a surgery which is restrictive, there is a surgery which is restrictive and malabsorptive. So depending on the combination of these two things, so the patient will tend to lose weight, but in a healthy format. And one more important factor which I would like to say is, when we reduce the content or the size of the stomach it also takes away, there are some cells which are located in the upper part of the stomach, which send signals to our brain saying, eat, please eat. So even those cells are taken away by this kind of surgery. So after the surgery, the patient will not feel like eating. That desire to eat is taken away. So there are some cells which are responsible for the patient to make him or her feel that eat, please eat. But when the cells are taken away, apart from restricted amount, the patient will not feel like eating. So that feeling is also taken away by the surgery. I would say probably this is a kind of miracle.
And once this surgery is done, suppose let's say at the age of 30,
Right.
once this surgery, then there are no chances that the patient will again become obese?
Well, there are chances that the patient may become obese because everything depends on how the patient follows up after the surgery is done. Bariatric surgery is intended at making or helping the person or the patient lose weight in a scientific manner, because we expect that the patient is going to lose weight over a period of 8 months to 12 months. Whatever amount of excess weight that he has, he is going to lose over that period.
What is the approximate loss of weight?
All right. Now, in the initial 1 year, what we expect that, for example, a person is, let's presume that a person is there who is 120 kilos and his ideal weight is supposed to be 80 kilos. So that means he is around 40 kilos extra. In that 40 kilos, once the bariatric surgery is done, out of that extra 40 kilos, he will lose around 25 kilos in the initial 8 months to 12 months time. 25 kilos lost in 8 to 12 months is a good scientific weight loss. And the rest of the weight that is supposed to be lost, that is around 15 kilos, that he will lose it over the next 6 to 8 months. And that is a healthy kind of weight loss. I am stressing on the healthy weight loss because many times people feel that by such weight loss, there will be many other problems that one can attract. So it is not so true. So this is a scientific and a proven kind of weight loss method.
And you have to follow restricted diet.
Absolutely. Once the surgery is done, or probably I can say before the surgery is done, we put them on a particular liquid kind of diet. So we assess two things in that: whether the person is able to take or tolerate that liquid, and whether he or she is able to lose some weight before the surgery is performed. And also from a surgeon's point of view, it helps in shrinking the size of the liver, so that performing the surgery in that patient is easier for the surgeon as well as for the patient. It is less prone for complications. And after the surgery is done, the patient is definitely going to be pain-free because it is a laparoscopic surgery. Whatever minimal pain is there, that will be taken care of by the medicines. On the same day, we make the patient walk. That is the advantage of laparoscopic surgery, which I was mentioning earlier. We make them walk on the same day, and next day onwards, they will be on liquid diet. And the liquid diet should be continued for the next 2 to 3 weeks, and gradually it is moved towards a soft kind of food. And once this transformation occurs, that they have understood and they have taken liquid, they would have lost around 7 to 8 kilos by first month.
And then there are no restrictions on activity.
Restrictions on the activity in the form of they should not be lifting any heavy weight, because there are some small cuts and these obese patients, they are prone for some complications of hernia. So restrictions are in the form of, one is diet. Diet is supposed to be taken according to dietitian's advice and the surgeon's advice. Second thing, with respect to physical activity, they should not involve in heavy physical activities, at least for the initial 6 weeks.
That is all.
Yeah, that's all. That's all.
It is not a ban throughout life.
No, it is not a ban throughout life, because it is a laparoscopic surgery. It is going to be a 6 weeks of limited activity.
So they can do outdoor sports, they can do exercises.
Absolutely, yes. Once they have crossed that period of 6 weeks, they can start getting involved in a lot of other activities. Apart from their routine walking, their physical training can continue. They can do all sorts of things after a period of 6 weeks.
Oh, good.
Yes.
Now, with fat loss,
okay.
Because of restricted diet or because of a different diet, are there any chances of like say vitamin deficiency arising out of it?
The diet that is planned for a bariatric patient is a well formulated kind of diet that is given by the dietitian in the hospital. For example, we have a dietitian, they plan everything out when we have a bariatric patient, and it is proportionate in such a way that all the nutrients, the macronutrients are proportionate in that the diet that we provide. And after the surgery is done, they are required to strictly adhere to these diet changes, and they also are supposed to consume certain vitamins in their daily life. That is going to be a kind of, I can say, a lifelong thing, wherein they have to consume vitamins, and they are supposed to be following up. Because I mean, I would say in a bariatric surgery, the relationship between a patient and a surgeon is going to be a lifelong kind of situation, wherein they're supposed to follow up with the bariatric surgeon on at least 3-monthly or 6-monthly basis, just to understand how is their nutritional status, whether they are deficient in any vitamins, whether they are deficient in any minerals. So we have to estimate all these things. So it's a kind of strict regular follow-up wherever they are. I mean, if they are not in their place, if they've gone to some other country or some other place, they need to follow up with the available bariatric surgeon. That is how it is.
And recurrence of obesity, like you said, is mostly because no control on the tongue.
Absolutely. Right? Usually what happens, sir, is at the end of around 2.5 to 3 years, there are chances that the patient who has undergone surgery, they may start regaining the weight. The reasons may be in the form of, if they start eating a lot of sugary food, if they are not physically active, their exercise is lesser, then there are chances that they will start putting on weight. They may start putting on weight a little earlier also if they fail to strictly adhere to the diet and exercise plan. It is not that only bariatric surgery is done and they are going to lose weight. No, 50% it is by the bariatric surgery, and 50% effects we expect from the patient that they strictly adhere to the diet and the exercise regime, which is supposed to be there for the rest of their life. When they regain weight, yes, I mean, we have to plan something. So there are certain modalities of treatment which are available for those patients who start regaining weight.
Can bariatric surgery be repeated?
Absolutely, it can be repeated. Repeated in the sense, not the same surgery probably, but there are different types of techniques. There are different surgical procedures. They can be performed in these patients who have lost weight in the initial 2 years or 3 years, and they have started regaining weight. So that the section is totally different.
But it can be done.
It can be done. Yes,
patient can be helped.
Yes, patient can be absolutely helped. So that's called a revisional bariatric surgery.
Now, doctor, tell me one thing. There is something called as liposuction.
Yes.
Which also removes fat from the body.
Right.
When do you suggest liposuction? Now there is a fat in the stomach, so you remove by liposuction, and you do bariatric surgery.
Right.
So when do you suggest?
Suggest both. Okay. I would say, as the word suggests, lipo is fat. Suction is you basically suck out the fat. So, for example, the best possible thing I can give an example to is when somebody has a big paunch or a big belly. So, what he is concerned about is only the belly. Rest of the parts are okay. So, what he or she might think is, let me go for a liposuction and get the fat removed in that area. So, when they think about liposuction or they want liposuction, it is only about a localized area. Sometimes somebody may have excess fat in their arm. Some may have excess fat in their thighs. Okay, so when somebody's got an extra deposit of fat in these specific areas, they can think about liposuction. But it is absolutely not a good thing for a person who has full body deposition of excess fat. Full body extra fat deposition, they have to think about bariatric surgery. Liposuction is meant for only those areas. For example, there is there's a focus of fat which is a lot more than normal. So that part can be taken care of by liposuction. And once liposuction is done, there are chances that the fat may accumulate there again. Yes, it may accumulate there again. And sometimes, I mean, not everyone, sometimes the skin may become loose or lax in that. So to correct that, they might have to put an incision or a cut there and then correct the skin, which is loose. Even that is a possibility. That is liposuction.
And what is the minimum and maximum age where you can perform bariatric surgery?
Okay. Now, as we discussed about the adolescent obesity, which is a rapidly growing thing nowadays because of the pampering that's going on. So I would say any age between, I can say, around 60 years, 16 to probably 65 years, we can consider the bariatric surgery. Depending on what the comorbidities are in a person who is aged, we can consider this kind of surgery. Yeah,
nice. वो एक वेगळा विषय. बॅरिएट्रिक सर्जरी. बोदोळे हांवें सांगिल्लें तशें आमची भुरगीं मोठी जालीं की आमी बरें म्हणटात वा वा बरो दिसता म्हणून, गुलगुलीत दिसता, काय बरो दिसता, पूण ताच्या भितर पळय जें सगळें चलता तें आमच्या लक्षान येना. आनी आज तर डॉक्टर कुलकर्णीन सांगलें तशें आमी एरिएटेड ड्रिंक्स पितात, भायलें खातात, बेगीन खातात, गोड खातात, कितें खातात म्हणून विचार नजो. घरचें जेवता कमी जेवतात आनी भायलें चड जेवतात, ताका लागून हें जाता. आनी तें जाल्यार कमी करतलो जाल्यार ही लॅप्रोस्कोपीक बॅरिएट्रीक सर्जरी म्हणटा पळय ताचो खूब उपयोग जाता. हांवें पेशंट पळयल्या की जांकां ताचो उपयोग जाला. नाजाल्यार दोतोर सांगतालो तशें ते रातचे घोर येताले, तांकां स्लीप एपनिया म्हणून जाता. ते न्हिदेन घुस्मट्टा सगळें आनी जागे जाता आनी तांकां कांय कळना, घाम येता, सगळें जाता, परत न्हिदतकीच परत तशें जाता. तें सगळें जाल्यार काडून उडयतलो जाल्यार पयलीं दोतोरान सांगलें जाल्यार पयलींच हें सगळें कमी करूंक जाय. नो स्क्रीन टू बी गिवन टू द चिल्ड्रन. आतांची भुरगीं सगळीं मोबायलाचेर आसतात, टॅबाचेर बसतात, खेळटात. गोड कमी खावप भुरग्यांनी आनी मुख्य म्हणजे घरा भायर वचून खेळप. बॅडमिंटन आसूं, फुटबॉल आसूं, क्रिकेट आसूं, भायर वचून खेळूं जाय. हें जाल्यार भुरगेपणांत करत आनी तें जाल्यार चालू दवरत जाल्यार मागीर तरातरांचीं दुयेंसां जायना. आनी फॅट आंगांतलें कमी करपा खातीर म्हणून आमकां सर्जरी करपाची गरज पडची ना. पूण तें आमी सगळें करिनात आनी म्हणून मागीर आमकां मणिपालांत डॉक्टर कुलकर्णीक सोदीत वचचो पडटा. हें खरें. डॉक्टर, थँक्स व्हेरी मच. एब्सोल्युटली ए न्यू ब्रांच इन मेडिसीन, a new surgical branch, and an expert like you explaining this totally to all our viewers. I mean, we are really obliged to you, and thank you very much that you found out time in your busy schedule and came here specially to give in detail information to all the viewers. हो कार्यक्रम असोच दर आठवड्याक आमी तुमचे कडेन घेवन येतले. आतां आमी दोतोरां कडल्यान एका एका दुयेंसाचेर कितें कितें ट्रिटमेंट आसा तें आयकत रावया. आनी मागीर कांय दिसांनी तुमच्या तकलेन जे प्रश्न येता ते प्रश्न सगळे तुमी आतांच्यान बरोवंक दवरूंक लागात. कित्याक मागीर हेच दोतोर परत येतले आनी तुमकां तांचे कडेन डायरेक्ट प्रश्न विचारून तांच्यो जापो तुमकां आयकूंक मेळटल्यो. म्हणून दर आठवड्याक तुमी पळयत रावात ही कार्यावळ लायफ्स ऑन विथ मणिपाल हॉस्पिटल. डॉक्टर, वन्स अगेन very thankful to you.
Thank you.